All right, Tommy, should I go ahead? Everybody in?
I'm still giving everybody
A
permissions for
couple
roll
minutes.
call, but if you want to, you can start.
Welcome. Welcome, everybody. We're going to just give it a couple more minutes to make sure we have quorum. Just give me the signal, Isabel.
Okay, I am ready now.
Okay, great. Hello, everyone. Welcome to our May meeting of the Community Engagement and Communications Committee of the Universal Health Plan Governance Board of Oregon. So we're going to do a quick tech check, roll call, and agenda review as we get started. I'm Amy Fellows, co-chair of this committee, along with Michelle Glass.
And for our tech check today, we do have Spanish interpretation available. If you click the sort of globe icon in your bottom menu bar, you can select either English or Spanish, whichever language you would like to listen and speak in today. For committee members, please remember to stay muted when not speaking, and you can use that same menu bar to unmute and start and stop your video. And for members of the public, that function is turned off until we get to the, unless you've signed up for public comment later in the agenda. And I think with that, we will just go straight into a roll call and then we'll go into agenda. And one more click for me. And okay, roll call. Michelle Glass.
Present.
Amy Fellows.
Here.
Grace Hawcock.
Present.
Mickey Derting. Don't see Mickey yet. Colin Stackhouse.
Present.
Max Brown.
Here.
Jensina Hawkins. Didn't see Jensina yet. John Buzzard.
Here.
Juana Yesenia Hernandez Solis.
Here.
Jocelyn Ogden.
Present.
Craig Newton is unavailable this evening. Juan Pablo Villalobos Garcia.
Here. Present.
Thank you. And Jay Brown. Did not see Jay yet. So thank you, everyone. That's our roll call.
All right, so our agenda today, we're going to have a board update from our executive director, Mimi McDonald, and we are going to go over the focus group report and have time for public comment. And then one of our committee members, Colin Stackhouse, is going to share the results from the town halls that Healthcare for All Oregon held. And then we are going to reflect and talk about future topics. I think Mimi's up first.
All right. Thank you so much. Good afternoon, everyone. I hope it is as sunny and beautiful where you are as it is where I am here in the Dalles. I'm Mimi McDonald, the Executive Director of the Universal Health Plan Governance Board. So just providing some board updates to this committee. The board had a meeting, a video-only meeting on May 12th to review and discuss the focus group report that you all are going to do today. So they had a bit of a preview. And then at our last meeting, which was on May 21st, which was hybrid, so in person and virtual, as usual, we had a packed board meeting. We heard from Professor Chow who is an international expert on unified health plans, and he helped Taiwan as well as Dr. Chunwei Chi with their transition over to a single payer plan. So he spoke about possible savings that are available from Oregon's unified universal health plan, and also commented on some of the topics from the Milliman report. We had a discussion and the board was able to come together, which was very exciting, about approximately the amount of percentage of total cost under a universal health plan that might be able to be saved with administrative savings. So that was good. Of course, it's a ballpark figure and things will be subject to change, but that was great. Echo Northwest, our fantastic consultant group, Morgan Shook, gave a report and presented the Echo Northwest report, and then gave an update too on some of the work that is being done. They are, Echo Northwest is helping staff and other committee members working with the Legislative Revenue Office and predicting the amount of funds that would be available in 2032 if the revenue plan was to be implemented. So that's incredibly helpful. And then the Echo Northwest is also working on what will end up being a sort of a calculator that will be available. I think we've talked about it at this committee. Once the revenue plan is sort of completely actualized and all of the different components of it are decided upon, then people will be able to go to the website, enter in either currently what they're paying under for their own health plan, or using, there will also be some standard amounts that would be available, and then they could see what it would look like under a universal health plan. So we're very excited about that. It's still a couple months out, but they're working hard on it. We also had a great discussion about some of the elements of the basic revenue proposal, and I will say two of the elements the board actually has made a different decision than they had initially, and I'll say two of them. One was related to something called the household size rate reduction, which was related to a number of people in a household, and for those households that had higher incomes, if there were more members present in the household, they were under that plan, they would have paid slightly more. The board ended up, after a lot of discussion and lots of good back and forth, made a decision to take that out of the revenue proposal. So that is no longer in the basic revenue proposal. The other thing that was a big decision that the board made, which was to, instead of providing a tax credit that would go towards people who are eligible, who are required to pay Medicare Part B premium. So instead of them receiving a tax credit, the decision was made for the universal health plan just to cover the cost of all Part B premiums for people in Oregon. It does raise the total amount of funding that is required under a universal health plan, but there's a lot of discussion about this, but in terms of sort of equity and who that burden fell upon, the decision was made to cover the cost for everyone. And the other thing is that it certainly will simplify sort of the understanding of the revenue proposal and the administration of it. So there's that. And then also Senior Policy Advisor Lee Hastings has been working with board and committee members about what the and other stuff as well about the final report, and an outline of the final report was provided, and a discussion about how board members are going to be able to interact and provide comments on the report. Drafts of the report are going to be posted on the website and available for board members and completely the general public as we go forward prior to each board meeting. So if you're interested, please click on the board meetings and look for meeting materials. So that was a lot. I'll ask my board members, Amy and Michelle, if there's anything else they wanted to add to that.
I don't think so. I think that was pretty thorough.
It's a great meeting. All right, then I will, oh, one last thing. Yes, hugely important. So very exciting. well, exciting / sad, as we've talked about previously. Again, both Michelle Glass and Amy Fellows will be, after their dedicated service, will be rotating off the board. Michelle will be finishing up in September of this year, and Amy will finish out in December of this year. So there are 2 open board positions. These open positions are the community engagement positions. So of course, all people who are on this committee are certainly people who would be the type of person who we would love to have apply. So there's a link on here to go to the boards and commissions website, how to apply. And then there's also a board member handbook to get a kind of a better sense of what board members do. We will say applications must be received by June 22nd. And then those will be, there's a small group of board members who are going to be, after staff have done the initial review, will be going over those and making a final recommendation to the governor's office on July 1st. So please do apply, tell your friends. Thanks. And I think that's it for me.
Yep, I think so. So Michelle and I are going to tag team this next part, talking through the focus group report at a high level, but in the materials for today's meeting is the actual report in English and Spanish, if you all want to refer to that on the website. I don't know if it's handy for staff to plunk in those links, but Michelle, I believe you're up first.
Thanks, Amy. Hi, everyone. Michelle Glass, she, her pronouns, co-chair with Amy of this amazing committee. Apologies to folks who attended our May 12th board meeting. This will be a repeat, but everyone loves leftovers. So I hope you enjoy it again. I know that this committee was very interested in seeing the report from the focus groups. So stop us at any point if you have questions or comments. Yeah, we will just use it as a kind of a discussion guide. So we're going to walk everyone through what we heard in March from the focus groups. And before we start, we want to acknowledge that the report itself, this is like just a very kind of the broad strokes. So the report itself has a lot more detail, and I really recommend, if folks haven't had a chance to really dig into it. I'm so grateful to everyone who shared their perspectives. There's a lot of great insights in the report for the board and for future work. So this presentation doesn't replace all that detail, but it will give you kind of the arc and the highlights. And then also, just as a reminder, I want to be really transparent that Amy and I were deeply involved in the planning, materials development, outreach and recruitment and debrief process, supporting our amazing contractors along with the staff team that put so much time and effort into this. Thank you, Isabel. Thank you, Lee. Thank you, Mimi. But Amy and I were not in the room. So if there are specific questions about, things that were said or tone or things like that, Amy and I won't be the best folks to answer those questions. So hopefully we can tap you for those types of inquiries, Mimi, if you're willing. Thank you. And of course, board members not being in the room was intentional. We really wanted to create a space where participants felt like they could give honest feedback. And Oregon is a small state. And so we knew that board members not being in the room would support that, that outcome. So again, because of that commitment, all of the feedback is de-identified anonymous feedback. So we really wanted the lessons and not the names. So it won't say so-and-so said this or such and such organization shared this feedback with us. It's just going to have the themes and some quotes. The sessions were facilitated by Diana Bianco from Artemis Consulting and our amazing executive director, Dr. Mimi McDonald. And then but I also want to be really clear, because I know there's been confusion about this point, that Diana, none of the contractors chose the participants. That was the board that did that work based on recommendations from you all and from the other committees. All right. So before I hand it over to Amy to get into the real interesting bits, I just want to say that this took a lot of work. It was a heavy lift for our small and mighty staff team. And there were 12 different groups. The final focus group happened yesterday, which is really exciting. So that feedback will be coming in an addendum to this report. So really thankful to Bridges Oregon for helping to do the logistics and recruitment for a deaf and hard of hearing focus group that happened yesterday. So more to come on that. And then in March, there were 11 groups that were 90-minute sessions. And we know that all the folks that participated are very busy. They're running clinics and leading community-based organizations and navigating our complex health system themselves. But we're so grateful that you showed up and gave us your honest and pretty blunt at times feedback. And we commit to putting it into practice. So as we walk through this, we would love for you all to keep in mind, like, as the CECC, do you have specific recommendations for how this report might be utilized by the board to honor that feedback? And with that, I will hand it to Amy.
Thanks. Next. Yeah, so I'm going to talk a bit about the process. So the process was led by Michelle and I, along with staff, and from feedback that we got from you in terms of who to invite, and feedback from the board, we drafted an invitation list by drawing on your recommendations, board members, and community contacts. We wanted a genuinely broad cross-section, and I think that we got there. As Michelle said, there were 12 groups in total, from community members and culturally specific providers to health insurers, hospitals, labor unions, large and small businesses, and organizations led by people with disabilities, and then just yesterday, the deaf and hard of hearing community. Each session was 90 minutes. Before attending, participants received a summary of the board's decisions as of February, the same packet that's been publicly available. And I think we shared that with you all at our last meeting or a meeting before, one of the recent meetings. So people came in with at least a baseline understanding of where the board is. Questions were developed based on interviews with committee chairs, recommendations from the CECC, and then reviewed and honed by Michelle and I. So we were asking about the things the board actually needs input on and not just general impressions. Slide 3. The first set of themes we want to talk about was benefits. So what should be covered and how people should be able to access care. Across nearly every group, people affirmed the core vision of the plan, the idea that everyone deserves care regardless of the employment status or income. So that resonated, but people quickly moved from the vision to the details, and the details got complicated fast. On benefits, participants focused a lot on the scope of coverage, what's in and what's not, and what's out. Non-medical services came up, things like transportation, housing support, services that affect health but aren't clinical care. Dental came up in group after group as something people felt should be a core part of the plan, not an optional add-on. Vision was raised too, though with somewhat less intensity. So you can see this quote about dental being critical on the slide there. And on access, participants were paying close attention to provider access under a UHP, who counts as an authorized provider, how referrals would work, and whether people in rural areas or with specialized needs would actually be able to get care. There was also real concern about coverage for expensive or experimental treatments, how those decisions get made, who makes them, and whether there would be transparent processes people could trust. The through line in this section was people want the promise of the plan to match the reality of care. Coverage on paper doesn't mean access in practice. And Michelle's up next.
Yeah, so I'm going to give a brief overview of feedback from providers and employers. So they had a lot to say, which is great. On the provider side, we heard some excitement about the potential for administrative simplification for providers specifically, which is where a lot of cost savings will be. And we know that the current system burns providers out, and that billing and managing prior authorizations from private insurance companies and having contracts with multiple different types of payers with different rules is a real burden for our providers. So you can see the quote here where someone from one of the provider focus groups said, that eliminating that administrative burden would help with the provider shortage because it would help to attract and probably also retain, but they said attract additional clinicians to the state because we know this is a national problem for providers, not just Oregon. So that was an interesting point that was lifted up. And providers aren't just worried about what the plan does for patients. They're also really, hoping that this will allow them to focus on those patients and not drown in paperwork. Most of them didn't get into their helping profession, hoping to do a lot of administrative paperwork. On rates and payment models, we did hear a little bit more skepticism on the proposal. So global budgets for hospitals, for example, got really mixed reviews. So some providers saw the value in predictability, and others worried that it could have unintended consequences like forcing care rationing, which is a concern that we've heard. And fee schedules were raised in terms of like, would the payment in that set fee schedule be adequate? So basically a fee schedule means that the state would say, here's what we pay, and that's the payment that would go out to providers. So it would be predictable, and it would help to level out some of the current problem, right, where you have, Medicare pays lower than private insurance, Medicaid pays lower than private insurance. It would kind of level out those so that providers wouldn't be incentivized to have more private insurance patients in their clinic than Medicare and Medicaid. So that's a real issue now. So fee schedules would kind of average those rates and give a predictable rate for providers. And hopefully that would help all of us to have better access because providers wouldn't be trying to pick their patients. But there is a concern, if the state sets a rate, will it be adequate to cover costs? So that was something that we heard. I'm going to pause real quick before we get to employers because we've covered quite a bit. Are there any questions or comments?
And Mimi, feel free to add color commentary since you were in the room.
Yeah. All right, Fred's got questions. So not hearing any, feel free to raise your hands. So moving to employers then. Employers talked about decoupling health coverage from employment being a benefit, not just for their employees, but also for them, which was really interesting. This was especially true for smaller employers because it really does provide administrative relief. And there are a lot of smaller employers that just can't afford to offer group insurance to their employees. So this would really help to level the playing field when it comes to competitive advantage for attracting talent. Between large employers who have the admin staff and the budget to offer competitive benefits packages and smaller employers who cannot. So that would be kind of a win-win for employers and for employees. But then there's the tax piece, which is where things got a little more complicated. So you can see the quote here on the slide where one participant said that they generally love the idea of a graduated tax and protecting people under 200% of the federal poverty line. But there's a real economic reality about how we attract and retain skilled workers in Oregon and whether the universal plan is enough to balance a higher tax. So that's one concern, specific concern that we heard. Multi-state employers also raised ERISA complications. And again, for folks, quick refresher, ERISA is this law that says that the government can't tell employers what they can and cannot offer in terms of health insurance. And so the board in our recommendation, that's why we have a flat tax. So we don't, in the law, this wouldn't say like employers must cease to offer private insurance and only have their employees participate in the state program. It just says employers will pay this tax and we're going to use that tax to fund a state system. And so that's how we're trying to avoid a legal challenge under this ERISA law. So there are some employers that still saw a potential for some ERISA issues, even with the way that we structured it carefully to try to avoid that. Labor unions also had questions about benefits, generous benefits that they spent years bargaining for. and what happens to those benefits if they are more generous than this universal state plan, and how then the transition from whatever negotiated plan they have, how that transition happens from that negotiated plan to this universal plan for their members that they represent. But, on the bright side, the employer conversation wasn't like, please don't do this. It wasn't anti-universal health plan. It was just really hungry for more specifics that honestly the board doesn't have yet. So this feedback will help to shape the next steps. The board has been asked to develop a finance plan first and foremost from the legislature in the bill and the Oregon revised statutes that govern our work. But it's clear that focus group participants also have a lot of questions beyond that about political viability. And that's, the board really is not in a place to address those yet. So we were just listening. Colin, I see that you turned your camera on. Do you have a question? Not to pick on you.
No, it's okay. Yeah, I had my ears perked up because this is the second time listening, but first I'm able to ask. Is the multi-state mentioning that there still is a possibility of an ERISA problem for several employers? Is that specifically for those multi-state employers? Or can you repeat that again?
Yeah, and Mimi, feel free to add. I wasn't in this meeting. I don't know if this is.
Yeah, I would just at the meeting that I was in that had the larger employers, some were of the position like, oh yeah, we do different things in different states. It's not going to be a problem to do this because we have so many people in different states. And others were very concerned about the logistics and the strain on their system about having to implement different things. They didn't the meeting that I was in, they didn't specify the ERISA situation completely, but more just the challenges that it would have for them. So say it's a smaller company that maybe is in a couple of states and not such a a big one which is in several states and able to deal with it.
Okay, thanks.
Thank you, Mimi. And I think, one thing that we are very aware of is that administrative burden does create an incentive for larger multi-state employers to potentially look for a challenge under ERISA. So that's, certainly a concern that I have. And then let's see. Oh yeah, I'm just looking at the report itself, going back to the full text of the report to see what else there is related to this question. There was a concern from employers that the cost analysis does not include ERISA plans, which makes the cost analysis incomplete. So that's on page 7 under cost, revenue, and economic impacts. So anyway, I think there was like I said, a lot of hunger and excitement for more details and some really good questions. And you'll see in the report at the end, there's a list of questions kind of pulled from these focus groups for the board to really use to guide our work, which is super helpful. Does that answer your question, Colin? Okay, great.
And I would just add, and Mimi, correct me if I'm wrong, but in both these categories, we had more provider and health system people and more employers than when the task force did its focus group work in 2019 or whenever that was.
Correct.
So we did get more people to the table this round, at least.
Yes. Yeah, for sure. So I think we can go to the next slide and talk a little bit about costs and structure. So when it came to cost, revenue, and governance, there was a lot of complexity and a lot of honest feedback shared. So on cost, people understood that the board was proposing a fundamental restructuring of how healthcare gets paid for. But they also wanted to know what the real mechanisms were to control costs and basically the growth in the costs of healthcare over time. So, projections are one thing, but they really wanted to know, like, what is the cost containment strategy? What's going to keep the system from growing faster than promised? Which is a great question. We've seen a real, especially since COVID, a real acceleration in the cost of healthcare year after year. So if we create a revenue plan and check taxation system to fund a universal health plan with a certain level of benefits, based on a projection that then those costs go beyond, that would be really challenging for the state. So that was a question. So you can see the quote here, program growth over years and decades is a concern. What mechanisms protect the promise of cost containment? It's a really legitimate policy question that I think not just our board, but healthcare analysts, policy folks, watchdogs are really asking nationwide. On revenue, there was some skepticism about political feasibility, right? Would voters support this? One person pointed out that this was actually before the May primary, but they kind of predicted we can't even pass a gas tax in Oregon. How would we pass all these new taxes? So that's a question that participants had. And the board needs to be able to answer that question. I would say also the legislature is going to probably have to wrestle with that question about political viability. Not just with data, but with a theory of how public support gets built. And I think that's one place where our work around public engagement and the recommendations that we make in the report are going to be really critical, because we know without that engagement, it's not likely that we will build that support. On governance and structure for the plan, there was a consistent theme that emerged, which is the local needs really matter. And people are worried about a centralized system that loses sight of, the different needs across regions in Oregon. And this is not a new idea in Oregon. This is a kind of long-standing tension and concern between kind of the Portland-Salem centers of power and resources and the rest of the state. So rural communities, we did hear a lot about, the different realities in rural communities versus the more urban ones. The culturally specific providers that have different relationships with their communities than the large health systems. Like, how would we account for and capture all of these kind of dynamics and diverse voices that are really important for retaining quality of care and culturally specific care across regions in Oregon. So you can see here that one participant pointed out that the only thing more local than politics is healthcare, which I thought was really interesting. So, the regional advisory council structure that the board has proposed was something that got some attention as folks were discussing this. But people, again, wanted more details. They wanted to know how these would actually function and whether the regional hubs would have real influence or just be kind of advisory with no teeth. So that was a question that was raised. And I'm going to pass it back to Amy unless there's any questions or comments.
I have a question about the last sentence you said about like the different regional areas not having teeth. I'm curious about that. Is there sort of a record of maybe how many times that was brought up? Like, did multiple people have that particular question?
I'm doing a quick search in the document to see if it's mentioned more than once. I don't think we have counts in the report, like this issue was raised X number of times. Do you have anything to add, Mimi?
No, I think I'm trying to think back to the meetings that I was in. I think people were that wasn't a huge priority topic. I think, as you guys pointed out early on, a lot of what people were concerned about was more about the revenue side of things, and then also what will be, the plan design, at least.
Great. And just on that note, Colin, one of the things that Amy and I heard really clearly at the May board meeting that you were at from fellow board members was a real request for more resources around kind of what am I trying to say? Summarizing key themes from the public comment that we've received, not just in these focus groups, but since April of 2024, at the board meetings, at committee meetings. And so that is something that Amy and I have taken on. So we've completed 2024 public comment, both written and verbal. And we will be creating summary documents for the board that says, you know, here's how many public comments we got, here's how many unique public comments we got, here are themes from those public comments. And so I hope that those summaries and themes alongside these this focus group report can kind of give some quantitative and qualitative reference points for the board to keep in front of us as we make decisions moving forward. And so that will be a little bit more like, we got 25 comments asking for such and such, right? Versus this report is much more qualitative. These were like in-depth conversations. And so anyway, we're working on that, and we will certainly bring that here. Great question. Go ahead, Amy.
Great. So next slide. So the transition planning, if there was a single area where we heard the most uncertainty and urgency at the same time, it's around the transition from where we are now to this new system. People understood this plan doesn't flip on overnight, but many of them wanted much more clarity about what the path actually looks like. One participant called it the big thorny question that you can see here in the pulled out quotes. There was also a real tension that kept surfacing between the urgency of the problem and the difficulty of the moment. So with Medicaid cuts, federal uncertainty, strained providers, people are feeling all of that, and yet moving fast on something this complex carries its own risks. And one participant said, as you can see here, there's the tension of we desperately need this and this is a terrible time. What was encouraging is that people weren't saying, don't do this. They were saying, show us how. There was openness to incremental approaches, moving in stages, taking pieces of the system and transitioning them over time rather than all at once. One participant, you can see the quote here, offered, I do think that there's a way to transition this where you take chunks over time and move closer to alignment. So that's an invitation. It's the community telling the board you can build more support if you tell a clearer story about the path through the transition. Slide 7, Michelle.
Yeah. So the report includes some recommendations that came out of these focus groups, and then also a lot of questions that came out of these focus groups. And I think those are really, really helpful and actionable feedback for the board. And so this is a summary of some of the recommendations. So define and communicate the pathway, how we get from here to there, like Amy just said. Direct targeted analytic work to address key questions. So as you heard throughout this kind of presentation, there are a lot of questions around, like, you know, do we need to do more modeling? Do we need to hone these projections? Is there information or data we're missing? So more work to be done there, and you'll certainly see some of those recommendations in our report to the legislature later. A recommendation to continue to elevate transition planning and risk mitigation as things, you know, are very fluid in the healthcare space in the United States. Explore the use of transparent, evidence-based processes for difficult trade-offs. I think this gets to your recommendation, Nikki, that we've certainly elevated to the board and will be including as a recommendation in the report. You know, can we take some of the difficult trade-offs where there's not really a right answer? It's really just like, we can't have both. Do we prioritize A or B, and involve the public in those decisions directly? Commit to continued community and public engagement during transition planning and beyond, and review questions for future consideration. So again, the report has much more detail, but we wanted to walk you all through what we presented to the board as kind of a jumping off point for a discussion with all of you. So curious if you all have any thoughts about anything that you would, in response to any of this, or anything that you would highlight as a recommendation for the board and how to utilize this feedback. And I'll pass it back to you, Amy.
Yeah, so I think the next slide is just a thank you slide, and just want to acknowledge all the people who contributed feedback, participated in the focus groups. Of course, our team from Artemis Consulting and Wentz Jackson Consulting that helped frame these and lead these. And yeah, I think we have about 19 minutes before public comment that we can have a conversation. Mickey, I see your hand.
I do have some comments. Do you mind if I just switch over to my laptop? I'll jump back in. Maybe call on somebody else first.
Sure, we can call on John and then come back to you.
Thank you.
John?
Oh, am I okay to skip the line for a second? Or ahead of me. So I got, first of all, I would just to back up, like I kind of had a meta question about the groups that were invited to the focus groups relative to those that like we as a committee input into the, I know you guys built a giant spreadsheet and so forth that I just kind of curious about what, you know, were you all able to draw heavily? Like, for example, I was kind of wondering if there's a slide at the end of what you just shared that said, oh, these are the groups that were invited and who showed up. Like, I know you have to de-identify, but just out of curiosity, like, for example, nurses unions, provider unions from the medical field, can you guys just that's my first question is like, can you talk about the groups that were invited in a way that doesn't necessarily name names, or if you can even name like a group name or something?
Yeah, it's such a great question, John. I mean, I appreciate the sensitivity around it. You're right, we can't name specific names. I will say we did draw heavily on your recommendations. And we did, for example, hear from a lot of labor unions, a lot of providers. We basically, there was not a group on that list that we've all been looking at, right? Employers, healthcare, consumers, providers, CCOs, like we hit every single group that we set out to hear from. And we're really pleased with the level of participation and the quality of feedback that we received. So there is not a single group that we missed, which we're really excited about. And as to Amy's point earlier, there are some groups that chose not to engage in 2022 when the task force, invited them. They said, no, thank you. And we worked really hard to get them, make sure that they saw, that we were wanting to listen to whatever feedback they had. And they did come to the table and share their feedback. So we're really grateful. So every single group was heard from. And your recommendations were really helpful in that process. And that's all I can say.
And that even included, I don't recall how many, but some commercial insurers, which definitely was not coming to the table the last round.
That's really encouraging. One more quick thing, or just a couple of thoughts. So to pivot from just that general question to just some quick thoughts on what you shared. I think, Michelle, you pointed us to kind of a certain section of the kind of fully written out report. And I was kind of just looking at that as, toward the end of your and Amy's presentation. And so a lot of concerns, it's kind of even more sort of blunt feedback about people concerned about taxes and so forth and the impact on their unique situation, which you touched on, but just kind of a couple of thoughts just about positioning, just as I'm just throwing this out there. This is way down the road, but I'm just thinking about, when we the collective, we think about looking at our pay stubs, right? We don't necessarily look at it and think of Social Security as a, for example, a tax. It is a tax. Of course it's a tax, but I think most people think of it as a contribution or something. Like we see that, and we know that it's sort of coming back to us in some form later, even though that's a circuitous route. It's not necessarily dollar for dollar. It's actually more than dollar for dollar. And it may be the case that way so I just wonder, like, that there's kind of, we've got this language of taxation, which of course it is, but so is Social Security, but somehow federal taxation, that aspect of federal taxation has kind of escaped that stigma of being a tax, and instead being a contribution into a system where people have a shared stake in their collective well-being. And so, it's a kind of there's a kind of a burden there. And then this may be what you guys were suggesting. So that's point number two. Just a quick third point in terms of individual impacts, this may be what you were describing earlier about what Econ Northwest is proposing to deliver. But what it kept coming through my mind suddenly, and I hadn't thought about it a lot during our prior meetings, but thinking about the providers sitting in a room going, I'm a dermatologist or I am a surgeon, and I'm going, wow, what is this? You know, I'm trying to do the back of the napkin math here and thinking about what the impact this has on my practice, and thinking, you know, even short of like a complex calculator, which may be what you all have in mind, but something like saying for healthcare providers, this is a potential impact. You know, is it safe to say? I don't know if it's safe to say. Like, I'm just wondering, like, is this a circumstance where doctors have greater predictability in terms of their fees, and it's not so uneven and they don't have that overhead, but they may walk away with lower incomes. Like, they may not make as astronomically high incomes if they're a very specialized field. But to talk again about trade-offs, and just, I wish there was some sort of like, at some point there may be enough information to either develop like an infographic or a simple calculator, not something super complicated, that says, how will this affect me? That's super simple, not again, going back, you guys use the word, you know, simplicity as a trade-off. And I think the more that we can simplify this, and I mean, my opinion is there's a way to tackle the outreach where this is characterized less as a tax, more as a contribution. And then second, how does this affect me, and allow me to sort of see some graphic that explains that likely impact on me, whether I'm a provider, a doctor, nurse, regular day-to-day citizen, and, you know, how does this affect my taxation based on level, without getting too complicated with like a super complex calculator. So sorry, that was a rambling response.
Thanks. Yeah, I do just want to point you briefly, and this will get honed more as we move forward. But in the summary, the PDF summary that we sent to participants ahead of the focus groups and that we shared with you all at our last meeting and with the board, there is, starting on page 15, if you're looking at the page numbers in the PDF, but it's actually page 16 because it's a cover page. Anyway, there's an attempt to do that. So how would things be different under the recommendations in the Universal Health Plan? And of course, these are the recommendations as of February 2026. So some of these have shifted, but it says, you know, today under the UHP, and it goes, you know, individuals, employers, providers. So there's a little bit of that. So yes, and there's probably more that can be done.
Sorry, oh, is that what Isabel just posted?
Yeah.
Yeah,
Thank
okay.
you, Isabel.
And sorry, you all, just one last question. Where was that, Michelle, in this document?
It's page 16 of the PDF because
Okay.
there's a cover page, but if you're looking at the page number in the document, it's page 15.
Okay, got it. Thank you.
Yeah.
Mickey, are you ready for your?
Yes, thank you.
Uh-huh.
I didn't want you to move on to something else yet. I'm like, let me share with you a couple of things. So when you were mentioning about like the regional localities, how it's different throughout throughout Oregon. It made me think about this one time where we actually, and I'm talking about the Oregon Commission on Asian Pacific Islander Affairs, were approached by COFA, which is the communities referring to populations from Federated States of Micronesia, the Republic of Marshall Islands, and Republic of Palau. They were hoping to have, they have some health disparities. A lot of their, they have the same access to health benefits here in the United States of America. They have a agreement with the United States of America where they could live here and work here and then access health benefits. However, it was severely underutilized. For example, you know, they have about 9,000 folks here in Oregon, but only 17 dental visits. So one of the recommendations they had is having, you know, different I'm blanking on the wording I'm looking for, but culturally competent type of regional offices that folks with where, you know, English is second language, or there's like cultural specific trust issues, where it would be helpful to make sure we're engaged and that benefits are utilized and accessed through that. The other thing with regards to regional connections and being really understanding the local community and their needs and their gaps. So for example, the governor, I believe, has a regional coordinator group that they have one, and they have advisory bodies per each region. And then I think Oregon Housing and Community Services is also thinking about doing something similar where they would have different contacts for different regions so that they would learn more about what the different regions' needs and gaps are. So I could see maybe like for this, you still have a central office or central organization, but you have these regional teams that could report back to you on the real needs, and it could be local people who knows the community, which would be very helpful. And I'm not sure if you'll have to forgive me. I had to get in my car while getting on the call. Did I hear you say something about community engagement and one of the recommendations with regards to civic assemblies? Oh, okay, cool. So I wanted to share with you too that there is an organization that, brought their work from Europe to here, and they met with governors across the nation and nonpartisan governors, and there's a lot of interest in states right now. And I believe they've also reached out to state leaders. And so there's a lot of interest, so there might be some warm reception to it, and potentially, and don't quote me, and I know this is public, nobody quote me, but there might be some grants too. So it could be expensive at first, but there might be some grants from big foundations that really want to ensure that we modernize the way we engage with the public. So I could share those as I hear it, or probably not, because then, you really have to apply for it still though. But I believe there's a lot of interest from grant funders to, award states and to actually use this model. Just thought I'd share that.
Yeah.
Thank you.
Thank you, Mickey. And if you think of it and have a chance, if you could email over the name of that org that you just mentioned that came over from Europe and has been meeting with governors, that'd be awesome.
Oh, yeah, that I have. I'll share it with you via the. And I have a connection too. I know the executive director. I'm happy to connect you or whatever you need.
Thank you. That's great. Colin.
Yeah, I have two questions or comments, but then first, like a little bouncing back off of Mickey's mentioning of this organization that's trying to work on grants. I think I need a little hand-holding with people more plugged in with government. Is that a possibility for the board to receive a grant from an outside organization, even though it's a state agency, or is that sort of off the table for the governance board and maybe DCBS? I don't know much about that.
I know at a local government, yes, we're like, please take. And from what I understand on one of the commissions that I'm on, I believe we're always looking for grants as well because there's not enough state funding for some of the commissions. I imagine that there would be some acceptance for private philanthropy and public funding because diversifying funding makes it a little bit more sustainable as well.
Cool. Okay.
Were you going to
Mimi,
add something, Mimi?
Yeah.
Yeah, I was just kind of going to echo Mickey's sentiment, but I will definitely look into much more detail about the specifics around DCBS and the UHPGB.
Okay, cool. Thank you. My real question, or just sort of comment, is on the report from Diana that we just went through. So I'm looking at the document that was shared, like the March 26th focus group report PDF, and I'm on page 11, so page 12 in the document, which is the recommendations, and then the next page are the questions for future consideration. And so I guess my broad easy question is like, how soon can we do all of it? How soon can we follow all of the recommendations that the focus group, found could be helpful? And like, maybe how soon do we get the next series of focus groups where some of the additional questions might be considered? And I guess to be more specific, the second section that talks about more directed analytical work, I guess I'd like to hear from Mimi, Michelle, and Amy about like how the process of getting more analytic work about modeling provider payment levels by geography or any of those parts of that paragraph about clarifying system build out and transition costs. Like, what's the process for more analysis?
I think since you attend our board meetings, I think you know at the beginning, Mimi usually always goes over the budget and what we have left for this biennium. And I think pretty much we are at the end of all of our contracts. So it will not be until, the next biennium, at least for further activities of that kind of level. And Mimi and Michelle could add more, but kind of that's a short answer, at least not this biennium because there's no money.
Yeah, I would say yes to what Amy said. There's certainly not money for additional consultation, but the staff and committee members and the board were working hard to leverage the relationships that we have with other state agencies and things like that. And so, for example, the Legislative Revenue Office is generously, providing time and expertise. So, and I think some of the work of the transition committee, which again, I really appreciate, and this work is really to point the way towards some of those key questions, to answer what we can, but to, as much as possible, clarify what other work needs to be done. So it's sort of both and. But no, there's not a lot of money floating around.
Yeah, that's in addition to what Amy and Mimi just shared. I would say, we are, myself as a board member, I'm really seriously using these recommendations and questions to guide my lens as I draft and review our report to the legislature. Because we need to align our resource requests and our recommendations to the legislature with, the feedback that we've received. So I think that's one immediate place where it's being implemented alongside guiding transition committee work.
Okay, thank you.
I think we are about at time or in 1 minute for our 5 o'clock public comment. And I believe Isabel said we have 2 people. So we should probably pause a minute, transition to that. But I think if there's further conversation that people want to have about the focus group report, we can probably spend a little bit more time on the other end, especially because we only have 2 public comments today. So we'll have a little wiggle room there. So Isabel, I'll let you, as the clock ticks here to 5.
Yes. So thank you, as always, to the members of the public listening in and providing public comment. It's very appreciated. You all can submit public comment at any time via our website. The deadline for written public comments is 72 hours in advance of the meeting, just so we have time to get that circulated and posted. And the deadline for the oral public comment hour that we're about to do now is 24 hours in advance of the meeting. As Amy mentioned, we had 2 people sign up for public comment today. We have one of them present right now. Rob Archibald, in just a moment, you'll be able to share your public comment. You'll have about 5 minutes to share your comment, and I will display a timer up on the screen. I've just got a little bit of clicking to do before I'm ready. Okay, so that timer should be up now in a second. There it goes. And Rob, you should be able to unmute and share your comment now.
Hi there. I'm Rob Archibald. If you've seen my public comment, you'll know a little bit about what I'm about to say. But just so you know a little bit about me, I'm the CEO of a healthcare-based, Hillsborough-based healthcare cost containment company. I've spent the last 25 years doing technology, and then the last decade doing healthcare, specifically technology for self-funded employers and union plans across Oregon and throughout the country. And I'm here because I believe in what you guys are trying to do. I believe in this effort. I have 5 kids. And I'm actually quite concerned about their future. You know, as you all know, the rising cost of healthcare is simply not sustainable. And this is my whole business. So this is what I do all day long, is I think about the rising cost of healthcare, and I think about how to build and design plans to make that better. You know, our business regularly is able to cut costs for commercial plans by somewhere between 25 and 45%. And we work together with large organizations such as Health Rosetta and many others. And this is like our focus and our mission and vision. My personal vision and mission is to cut the cost of healthcare in this country by 50%. So I've got a big bar set for myself. So I'm here because I'm a little bit concerned that, you know, without some course corrections, I think the Oregon Universal Health Plan is going to share the same fate as Measure 23. If you're familiar with that, it was proposed universal health care coverage in 2002 in Oregon, and it lost 78 to 22% in every single county across the state. And then more recently, Measures 97 and 118 also failed by fairly lopsided margins as well. And I guess I want to say I love what you're doing, but history has shown that when ambitious proposals designed by people who already agree with each other are sent out, they're often rejected. And I feel like the public needs to be a co-author of this plan, not an audience member. I came to the HCAO board meeting in Hillsborough a few months ago, and that's kind of what got me started in this. And I felt like very much like an audience member. I didn't feel like I had input. I also didn't feel like the message and the method that was going about was perfect. And so I feel like there's a better model, and I think we're very well positioned to use it. Many of you already know in Taiwan has used an open source platform and technology to be able to get input and guidance from people. For example, they used it to gain consensus and come up with things people believed in and shared for things like ride sharing and telemedicine. And, you know, it's something that we have the opportunity to do as well here. And we can produce legislation and regulation and things that everyone can accept. So I believe it's time to use some of the same things that they have built. And I would like to join the Community Engagement and Communications Committee so I can help bring tools like this to the process. I believe that in order for this to work, we have to have a program that Republicans, Democrats, rural Oregonians, urban Oregonians, everyone can agree on. They may not all love every part of it, but everyone will have parts of it that they should love. And I want it to be something that we all can call our own. If it feels like it's created by us, it's going to be accepted. And I guess that's what I'm here to do, is I would love to be a part of it. I'd love to help you continue to gather this input. I love the focus groups. I love these discussions about helping to get more input. And I feel like this is a great way to be able to do that in a cost-effective way. And I hope that, you know, I can help out. Would love to be a part of it. Thank you.
Thank you,
Thank
Rob.
you.
Go ahead, me.
And did we have another public
It doesn't look
comment
like
today?
the other person is present, so if they show up, I'll send you a note and we can come back to it. For now. No one else.
Okay. So thank you, Rob, and thank you to everyone who submitted written comment that's in our board material, or I mean our committee materials that people can see today. Do people want to continue our discussion about the focus group report before we move on to committee member updates, or maybe take a break? Sorry, I just threw out 3 options. Is there any more conversation about the focus group report? I'll ask first.
I have a more, yes, I have another question. I guess related to, let's say the board was choosing to prioritize one of the specifics, you know, potential actions, more research on different, you know, geographic changes in pay, for example, was one of the, or I think that was one of the comments on like the things to look into further. If all 9 board members were in agreement and this is a hypothetical, right? Like, let's say there was a prioritizing of that. Once the next biennium is passed, what is like the earliest, like throw out a date for when that would start? Did that question make sense? Like if things are to be prioritized for further research similar to the focus groups, when would that potentially happen is my question.
So the new biennium will start July 1 of 2027. That's the earliest that, depending on how quickly state funding rolls out to agencies and then from agencies to the board, that would be when, you know, when those monies that are allocated by the legislature would be available. What's going to happen in the long session next year is anybody's guess. It's, you know, every month is like 10 years right now and a lot happens. So, but that would be the timeline. So this biennium started July 1st of 2025, goes through June 30th of 2027, and then a new 2-year budget cycle begins that starts July 1st, 2027 and goes through June 30th, 2029.
Thank you. Still helpful. I'm sure I'll ask again some other month, but appreciate that.
Sure.
Yeah, it's not, you know, not stuff that rolls off the tongue or sticks in the brain. But yeah, happy to navigate it together.
There are other questions from the focus group conversation? Would people like a 5 to 10 minute stretch break now before we have Colin present the HCO town hall survey results? Or do you want to just keep plunging through? Any strong feelings?
Staff votes for a 5-minute break at least.
Okay. All right. Let's take a 5-minute. I mean, I think we probably have time to take 10 if people need it. Let's come back at, oh, go ahead, Michelle.
Go ahead.
I was gonna say, let's come back at 5:18 and then Colin, you'll be up next. Does that work? Okay, see y'all in great. Looks like we're getting people back here and we are slightly changing what I said because our second public comment person did arrive. So we're gonna have them go ahead and give public comment before Colin does his presentation. We have 1 more minute, we'll give it since we said 5:18. And if KEC members can either put your camera on or indicate in the chat that you are back, that would be great. Isabel, are you helping me keep track?
Yes.
Are the people we started with back?
I think pretty much everybody is.
Okay.
I said so.
Okay. So Isabel, you can take it away for the second public comment.
Okay. So Lou, I had you signed up for public comment today. I think you know the drill, but you should be able to unmute and share your comment whenever you're ready.
Well, thank you. I totally spaced it out. I got two meetings mixed up one another, so I'm glad I'm here. My public comment, I think I'm really worried and concerned that the board will not finish what the law says, and that instead of having a plan put together, we're going to do a report. So I'm curious to find out just exactly what the plan is after that. It's very worrisome because we haven't figured out the savings to the plan. And when you start looking at the system that we have, it has been so bureaucratized that it has, it is, how would you say, that every facet, there's so many facets to the insurance plans that their fingers creep into everyday life and in every, in almost every state agency. For instance, we don't know how this will impact other related state agencies. There's been no research done on that at all. You know, workers' comp, they've tried to say, oh, well, workers' comp, we'll send them the bill afterwards, right? Which is ridiculous. That's going to create more impact and more bureaucracy. The same on regions. Regions, there's no relationship to regions at all that's been carved out by the board. You know, I'm in a region in Eugene here, in the same region as Coos Bay. We are not related at all, except that we're in the same state. Coos Bay is a coastal town. We're a Willamette Valley town. So there's been a lot of work done, and you should be very proud. However, there's been a lot of work not done. And I don't know where to turn or what to do. I don't know what to ask the legislators to do. A lot, you know, I spent a lot of time talking to the engagement committee to talk to those specific unions that are under their multi-employer unions, like UFCW and the Carpenters Union, etc. And they have trusts. Now those trusts, if they were all in the state, would be fine, but those trusts reach out across state lines, like UFCW. If we have publicly funded healthcare for members of UFCW, what's going to happen to the trusts that are up in Washington? What's going to happen to that? And nobody has researched that out. And I don't even think that the you know, the outreach program that was set up really talked to them in earnest. And again, what's the board doing to find out how to put out a publicly funded plan and still maintain the trust funds or acknowledge the trust funds? How do you want to treat the trust funds? Right? So I know I'm sounding like I'm complaining, and I guess I am. So I don't know what you have in store. You know, no plan, no savings, nothing. So I think we need to take a look at that. And I don't know if you have enough time to put the whole plan together. I don't think so. So are you going to ask for a continuum? And to allow you to have the time as the board and the engagement committee and all of the committees to really put together an acceptable plan that has the T's crossed and the I's dotted. So thank you for listening to me.
Thanks, Lou. Okay, Colin, you are up next.
Sure. Yeah. Thanks, Lou. Nice to see you. And thanks, Rob, too, for your comments. So this section of today's meeting is for me to sort of go through the results of our survey that Healthcare for All Oregon delivered at the town halls that were around the state. And I did submit a written document that was an intern of ours and another member of our team helped to develop. I wasn't able to submit it, I see, in enough time for Spanish translation, Juan Pablo, so my apologies for that. And in that same, or the same opportunity, same whatever moment, members of our volunteer data and research team were able to come together and create a PowerPoint presentation that better outlines and better displays some of the information that was already submitted, right? So that there's this PDF document on the CECC site that lists our report. That report has been turned into a little bit easier to understand slide deck. So my hope is that we can have me present this slide deck and then I can submit it for translation after the fact. I know that's not ideal, but at the same time, sort of feels like moving forward. Is that going to work, you guys?
Yeah, that should be fine.
Okay, sweet. Yeah. So yeah, I'm so grateful that I'm grateful for that, and I'm also grateful that we had the brain power on the Healthcare for All Oregon side. We're mostly volunteers, and I'm a part-time staff person. So love being here, love communication, and I am not a survey analysis person this month. You know what I mean? So I'm glad to have support. So we'll get into that. I'll share my screen and we'll get into it. You guys all able to see this? Perfect. Oops. So we'll talk about the background of the town halls, the characteristics of some of the attendees that we saw at the 9 events, the 8 physical and 1 virtual event. We'll talk about some of their perspectives that the survey showed about the attendees, take on universal healthcare, and we'll talk about next steps, both, I guess, as the idea of universal healthcare in Oregon, potential next steps for us to implement Healthcare for All Oregon, and also maybe next steps for the governance board to consider. So anybody raise your hand or interrupt if you've got a question. I enjoy more of a conversational approach, so feel free to pipe up if something interests you or you want to learn more. But we had it's funny, we had 9 town halls and I put 8 of them down. Where am I missing? What did I, Hillsborough? Shoot, how did I do? Oh, Silverton. We did one in Silverton. So excuse me, I'll add that to the slide deck. But we had our 9 town halls throughout the state. And in all of these town halls, we had a virtual survey and a paper survey that we handed out for people to complete. We had approximately 900 Oregonians over the whole series of 9 events. So around 100 an event is good. Anecdotally, Portland had 100 attendees. Hillsborough had about 100, LeGrand had 50. So those are some of the numbers. The virtual event had about like 200 at its tops. So the point of the survey was the point of the town halls was for us to share why universal healthcare is important both to us and we think the state, and amplifying the work of the governance board, updating people present about the governance board's work so far, and understanding the public's concerns and preferences around what a universal healthcare transition would look like. Yeah. So the majority of the folks that came to these events, and this is all self-reporting with not a lot of no way to ensure that people didn't take the survey twice, right? So we just have to assume that people are trustworthy and, taking benefit of the doubt for the way they engaged with the QR code and the paper surveys. But most of the attendees were between the ages of 65 and 74, although not all of them. There were still a big group of people that were in their mid-40s and late 30s. Most of the people that were present, most of the 504 respondents to this survey had health insurance through their employer. The next largest group, a little less than a quarter of them were on Medicare, and then Oregon Health Plan, Medicare Advantage. Just a tiny sliver of people self-reported to be part of the VA. This is, I suppose, to be expected, but I was still surprised, surprised at this political affiliation. And also, I don't know, maybe not surprised. I do hope that we help both Healthcare for All Oregon and also this is the Venn diagram of like things that are of import, both for the governance board, for HCAO, just for this effort in general. Any sort of survey where we've got 500 respondents and most of them are Democrat or self-reported as Democrats, same as Rob's concerns about maybe making a plan for a certain group of people without getting the input of everyone. So this is great that we were able to get this information and yeah, something to note going forward. A lot of people were concerned with healthcare spending. So below the ages of 65, about a third of the respondents were moderately stressed about healthcare spending. Once people hit Medicare age, finally achieved some degree of a universal healthcare system or some sort of socialized support, people were less stressed with their healthcare, which is great. Actually, that's really good. And still, there's a huge, not huge, but pretty sizable portion of them, about 10%, even with Medicare coverage, very stressed about their healthcare spending. So the cost of healthcare, just like I think from the focus groups, the cost is immediately the thing that comes up right away when people are trying to learn more. These are some of the perspectives on universal healthcare, and I'll talk about maybe our concerns for it afterwards, but 90% of the respondents of those 504 people supported a single payer system. 40% supported a sales tax, which is pretty interesting to hear that because sales taxes are very hard, I think anywhere, but especially hard in Oregon to try to push for. It hasn't worked very well. 74% of the respondents supported an 74% supported an ultra wealthy tax, and 92% supported a more progressive tax structure. These surveys, we were tried to be deliberate when we asked them, which was after an hour-long presentation, more or less. So just very open to changing this sort of framework going forward. But in the town halls, we had a presentation from Healthcare for All Oregon, 25, 30 minutes, then the presentation from the governance board, 25, 30 minutes, and then a survey about universal healthcare at that moment. The thinking maybe being like it's so convoluted that giving a little bit of education before getting people's perspectives was important, and also kind of boring in a way to have to sit through an hour of being talked at, answering some questions, and then finally having the ability to converse, which is the point of those town halls. So, but that's how it went. Those are the results. Just like in the focus groups, out of all the respondents, dental was this question was posed like out of the benefits that you would want cut, or like, excuse me, out of the 3 benefits listed, dental, vision, in-home care, which is the most important to consider being included in a universal healthcare plan? And dental, same as with the focus groups in these town hall surveys, dental was shown to be the highest desired at 64%. The selectable, this question listed these options for people to select about the things that mattered most to them. And the respondent then, and this, I'm sorry, in the report that is available online at the CECC page lists these questions, articulates them maybe a little better, but the question was more or less like, what's the thing that's most important to you in a potential universal healthcare transition? And quality of care was the thing that 219 respondents said was the most important, followed by affordability, easy access, and financial protection, which makes a lot of sense. And there was, in the transition process, the most concern from 138 respondents was the lack of trust in implementation. We sort of had a discussion with the data team about like what some of our questions, I think, certainly will be improved going forward. But what really does lack of trust mean? It's a little bit of a vague question to try to get some specific answers for, but people tended to choose it because There is a lack of trust in how Oregon can implement these sort of big changes. Concern about the quality of care once this transition goes forward, higher taxes. 100 out of about 500 people responded, so not inconsequential. And then government overreach in Oregon being the first state. There were also some people could write their concerns in a written format in this same field. And it's a little silly, but I'm gonna switch back to this report. Oops, excuse me. Which is this is a page from the document that is currently listed in the CECC pages. So this is available for all folks to read in English and hopefully Spanish soon. But the keywords that were mentioned most often when people were able to input their concerns about a universal healthcare transition were taxes, 31 mentions of taxes, 32 mentions of coverage, and making sure that different healthcare procedures or kind of support could exist in a new universal healthcare plan, cost and pricing, and also being able to keep the provider or mentioning concerns about provider shortages and also the transition. So once again, key findings is that there is a strong public support for this idea. I like, Amy, what you said describing the focus groups, that there's not a lot of pushback about it being a good idea, but definitely a lot of concerns about how do we get there and how do we move it from beyond an idea. A clear support for progressive taxation, concerns about trust and implementation, and concerns about trust in the government, and concerns about dental and potential overwhelming demand in this new transition. So I'll switch back to the slide deck, and I will submit this to Isabel for inclusion in future materials. So just a few more pages. So my intention is to submit this slide deck. I shall submit it to Isabel. And then also we have a transcript of all of our Q&A questions, which I sort of honestly take the perspective of more is more. And so it's 15 pages where we were writing during the town halls, the questions and a little bit of the conversation. And so my intention is to share that completely with the governance board, and you guys can take a look at the transcripts. And we might have some of our data team take out a few more interesting things from it, but I prefer to just give everything to you. We also have some talk about doing a statewide survey, like a different kind of survey organized by HCAO. And this question mark is from a member of our data team who wanted to bring up the idea of maybe UHPGB or some other DCBS or some sort of potential contractual arrangement for HCAO to execute this statewide survey. Just a line on a slide deck, so obviously not more to come for that potential kind of conversation. Additional town halls and community conversations in unreached areas. So we were only able really to go where we have a volunteer base, and that basically was LeGrand and then Bend, Medford, and then the Willamette Valley. And that's super limited. We were able to hit the 3 major counties in the Portland metro area. So that's an amazing push for our volunteers there, but we really didn't get into rural areas, and that's a problem. So I'm gonna go to the next slide, but really hoping to have maybe a conversation from other folks in the CECC about ways we can improve this kind of survey going forward. A little bit of a retrospective, like I said, there's a limitation in our outreach. We did, do lots of press releases, and we did have some news groups show up at different town halls, and there was good reporting out of Medford and also Bend. But I think that there's still not enough knowledge about what this could entail. So I think similar events from both groups, from the governance board, from us, likely will have more news attention over the coming years. Like I showed, self-reporting attendees from the Democratic Party, which is amazing. And also we need to do outreach to everybody in Oregon. A preference for an audience for this kind of event that is already support of universal healthcare. There was 90% of the respondents were interested in a universal healthcare system. Oh, and like I said, rural areas and other lessons to come to. So I have to acknowledge the data team who wrote the survey and made the presentation look better than what I could do in the report that initial report that I shared with the CECC. So Dr. Simran Chowdhury, Dr. Rebecca Schoon, Carrie Anderson, Melissa Santos, and Dr. Paul Ehrlich helped a lot with this. So that is it for the presentation. Love to have a conversation. Thank you.
Great, thanks, Colin. And I just put a little clarification in the chat that I'll say if people are on the line, just because it seems like this gets confused a lot, and I just want to clarify: Healthcare for All Oregon and the Universal Health Plan Governance Board are two very separate entities. Healthcare for All Oregon is a nonprofit advocacy organization that's been advocating for a universal health plan for decades. And they are separate from the board, but we are thankful for them. They're a helpful partner. We are thankful and glad to participate in the town halls. So just, I heard in public comment earlier, I just want to make sure people, know we are two separate things. And very appreciative. And do people have questions or comments for Colin about what he shared? HEC members, any questions about what you saw? Surprised, not surprised? People getting tired? Mickey, thank you.
Sorry. Oh, great presentation. Thank you so much. I was just curious. I wonder if there were also a balance of Republicans, if the answers would have been different as well. That'd be interesting to see.
Yeah, I hope we can get that answer. I want that answer. So, and I know it would be different,
John? We're not hearing you and you're not on mute, so I'm not sure.
Oh, sorry, that was a microphone misfire.
Okay.
Sorry.
All right, we hear you now.
To Mickey's point, kind of in looking at Colin, your great presentation of that information, I kind of like also sort of thinking about with that what you shared about that, what seemed like that unanimity of interest and even willingness to consider higher taxes, and then kind of comparing that to the same passage that pertain to taxes from the governance board's targeted focus groups. It just seemed like there it was a little more contentious. So I think that might be a preview of what we might see if we get maybe a little bit more broad mix of participants. So, and Colin, you mentioned maybe taking a next step with healthcare for all Oregonians in terms of further surveying. And I just wondered if what that might look like. Would that just be sort of like a population-wide survey, or are you guys at a point where you've talked more about that yet?
We are not at a point to talk more about that. Yeah, I was reminded of that. Yeah, when the team was building the slide deck for me in the last few days, I was like, oh, you're right. Tell me more about this pathway towards like a different kind of statewide survey. So nothing more that I can say about what we want to do besides an intention.
Yeah.
But I'm just going to say it out loud. I don't want the same demographic responses. I mean, that's not what we need, right? And so hope for more input from our members of our team and anybody about like ways that we can do it better. I think I keep saying, and we all know, meeting people where they are, and so getting away from the Willamette Valley, if there's more in-person events, that's like an obvious tool or an obvious like tactic, but not enough. Yeah. So.
Are there other questions or comments for Colin?
I just want to say thank you, Colin, as one of the board members that participated. It was a great experience. And this is something the board did not have the capability to do on our own. So I really appreciate the work that went into this, and also look forward to reading the 15 pages of Q&A transcription. That's a great, I was like furiously taking notes at the town halls that I was at and struggling to keep up in my little notebook. So really grateful for that, and we'll definitely read it. So thank you so much. And thanks for bringing this to CECC.
Yeah, agreed. Thank you, Colin. It was a great experience for me also being at the Eugene Town Hall.
Great. I love that feedback. Like I said, if there's more analysis of the comments, I'll touch base with data team and see if they care about that, or we'll just I want to give you everything. So we'll do that. Thank you.
Thanks, Colin. And I think that some of your last points about, getting outside of the I-5 corridor is a great segue to our next discussion topic, actually. So thanks so much for the setup. At our last meeting, we have a standing agenda item, which is future engagement planning. You all know the resource constraints that the board operates within, and also how critical community engagement, ongoing public engagement is to this effort. And so as we write the report to the legislature with recommendations, we check in with y'all every month to see if you have any additional thoughts or recommendations that we should include or consider as we're drafting that. And last month when we brought this up, one of the things that you all said was, hey, we need to have a dedicated conversation about rural outreach and rural outreach strategies. So I think our intention was to start that today, maybe make that like a little focus for our future engagement planning conversation. And just for folks on the call today, members of the public, the ideas that have been floated so far that I've taken notes on are media interviews, state of reform or other conferences, the civic assembly model that Mickey Durding has been talking about, and then this kind of desire to really focus on rural outreach and rural outreach strategies. So this is not the end of the conversation. We can certainly continue this really important topic to the next agenda as well. But would love to hear if folks have thoughts on this topic after percolating on it for a month. We just open it up to CECC committee members.
Mikey.
I have access to our Central Oregon business communities. They have a roundtable with the CEOs of the business community here. And I talked to the chair, was it today or yesterday, and offered to share information about this plan. I said, maybe I could get the board to meet with you all if you want and get your input. But she said, just send her the info. So I did post something on LinkedIn, put in your information, share your information to the board. So we're going to circulate that here with the business community through that business roundtable. And then I'll circle back. I'll try to get that out as soon as possible so that they could provide feedback back sooner than later. And then also, because of my work, I do have intergovernmental relations to the Tri-County here and the different cities within the county. So I could reach out to the commissioners and the council as well to see. They're usually the ones that are very well connected with their rural community members. So hopefully they can help as well in spreading the word and just increase the awareness about it. So I'll do that and see if I hear any feedback and share that with you.
Thanks, Mickey. That's great. John.
This is maybe along the same lines that Mickey shared, but so in my day job, I work in the professional and continuing education unit at Oregon State, which is housed within Division of Extension and Engagement. And so those of you all that are familiar with University Extension and through any land grant university, we actually have offices, a physical presence, employees of the university that are based in every county in Oregon. So there's sort of a lot of connectivity, the whole ethos, I guess you could say, or outlook of extension professionals. And again, I don't count myself in that category necessarily, but that whole sort of way of life, a way of being for extension folks is about community engagement. So it's a very community forward, community engaged practice. Oregon State has a community engaged designation. So I thought, if there's at some point where my experience with this subcommittee and my kind of day job could intersect at some point. And I was kind of waiting for that moment when how could we potentially activate, I guess the question I have, and it sounds like Mickey's a little bit further along in the thinking about how exactly to go about that. But so we have this actual infrastructure and connectivity across the entire state that's on the ground, folks that play softball together, the folks that are employees of extension. So I don't know, I guess from the governance board and from the leadership, this committee, what that engagement could look like. I don't know whether it's like, hey, share this talking points document, or, is there opportunities for leveraging that connectivity to do something along the lines of what Colin, and his group have done at a kind of more local level, and obviously touching on that with an emphasis on the rural outreach, which is where I think my colleagues have some strengths and some infrastructure. But again, I don't know what the ask would be, so I guess I kind of punt that back to you guys and say, does anybody else have ideas of like what we could do to leverage that connectivity? I'd be happy to go back to like the leadership that we have here in Corvallis and kind of pitch the idea. And in fact, I think our leadership would love it because they are big on engagement, so community engagement. So I don't, but beyond that, I don't know what the ask would be exactly yet. I haven't thought a lot about that, but I'm hoping maybe you guys can offer some suggestions and direction for me to do that.
Yeah, thanks. I love the idea of connecting through the extension centers. I think that Michelle and I will probably need to talk with staff and like with all of these ideas, kind of figure out what the timing of it and the sequencing of, like when do we want people really activated? And what do we have, resource wise? Because I don't know that we could like do a whole nother round of like the town halls and getting board members there when we're like dug into the report at this point, to make sure that we have that deliverable to the legislature. But I just wanted to say that I was so glad to see that the Lane County Extension Center ballot measure did pass after they counted all of the late ballots. So that was, I was nervous it was not going to pass. I'm sure you were too.
Yep.
So yeah, but I do like that idea, and I don't know if Michelle has other thoughts, and then we'll go to Colin.
Yeah, I would just say I'm taking notes on all of your ideas and I'm tracking them meeting to meeting. So I have a running list, and that is what we reference whenever like it's a resource for the board. We don't have to resolve it today necessarily. We're compiling recommended strategies and outreach, models. So I have added that. I think it's a great suggestion. So it will not be lost.
Okay.
Colin.
Yeah, thanks. This comment is just maybe about like the resources John and Mickey mentioned having of connections to either an extension or just business community. Thinking more another categories like libraries or things that are connected to our state government but are spread apart everywhere. An easy, seems easy, but we haven't done it, thing would be to like share information like the designed documentation, like the one pager and I think the half pager that the governance board created 6 months ago. That's pretty well designed. It's got like, you know what I'm talking about. It's got that dark blue sort of circle, and there's little crosses indicating health. So that kind of a thing could be potentially amplified by libraries or other places around the state, even just to like, the best way to do what I'm imagining would be to have somebody drive with a pile of paperwork, drop it off at these different locations, like a full, very immersive way to engage with the actual people in these buildings. And that's maybe not realistic, but I think sharing those documents that we do have at our disposal and other things in these networks, it'd be great if it could be automated. I don't know. In some ways it seems easy, but it probably isn't actually that straightforward to disperse this around the state. Curious your guys' thoughts about that.
I love that. Back in when the ACA was new, I was a application assister for the Oregon Health Plan and the new marketplace plans, and I went to every library in Jackson and Josephine counties and hosted like drop-in hours to help people explain, answer questions and help people through the application. And it worked great. And we reached a ton of rural folks and a ton of folks who were just going to the library, right? So I think this is like really an engagement best practice to not just, meet people where they're at, but like map community gathering spots and then resource those spots. So I think I took down your specific suggestion, and I also just put on our list, those best practices that I think you all are pointing to. So yeah, I think that there are levels that at which that could be done, more intensive to less intensive, but yeah, love that.
Just to keep popcorning on libraries, like in Portland, we've had so many of our libraries getting like totally remodeled, and it feels like it's like it's a new city on these blocks. Like it's so beautiful. And so really loving that at least Portland's putting an emphasis on those kind of communal third spaces. So yeah.
Other thoughts and ideas during this brainstorm?
So to clarify, we would be the ones going in person to these libraries, or would we be looking for volunteers to do that? Or to like just into those communities, into rural communities?
I think, oh, go ahead, Michelle.
Yeah, so what we're doing today, Jocelyn, is brainstorming a list of strategies for the board for future board engagement. And yes, and these resources, like the one pagers that Colin just mentioned, you all have them, right? They're publicly posted on our website. They've been emailed out. Certainly we could get you PDF copies if you, so there's nothing to stop anyone, members of the CECC, other folks, people in the future who are watching this recording, from printing those resources and going to the library in your communities. Libraries are run by counties, so they're very regionally specific places. And I think that's where the strength of a committee like ours is really visible, because we do have statewide, folks from all across the state on this committee that could be doing that work. And having someone who lives in the community lead that is really, I think, powerful versus somebody coming in from another community. So I've recorded it for the board's reference. And if you would like, some support in doing that in your community, I'd be happy to connect with you.
Okay, thank you.
And I was just going to add some of these ideas are really, we will add also to the report and like identify the need for community engagement to be heavily resourced in the future iterations of the board in the next biennium. So this is helping us kind of flesh that out a little bit more as well. John, your hand went up and then went down.
Yes. So I was just going to ask if you and Michelle could just, I think I asked this question about every 3 months or so, but just like a timeline, remind us of like how these things, as you take them back to the board in the further stages of public engagement, how they sync up with the timing of the recommendation, and like just like super high level timeline check, I guess.
Do you mean like what we're going to do with the recommendations from you all from these meetings? So
and then how that syncs up also with like when the formal recommendation will go to the legislature, all that kind of stuff, all the super high level stuff.
Yeah, so we are drafting right now. The Lee from the staff team is helping to support the board in drafting the report. And Amy and I are specifically drafting the community engagement section, both kind of talking about describing our process and what we heard from communities, and also making some recommendations for future community engagement in future funded phases of the work. So all of your suggestions are going into our drafts like right now, this week, as well as your suggestions over the last several months, right? We've been talking about this all of 2026. So that report is getting fleshed out, and your suggestions are going into that. And then it will be submitted to the legislature, I think, as we all know, in September.
So in a way, I guess part of going back to, I guess, the question about how soon do we activate, or how do we activate? So we might not see like another giant push until the board kind of absorbs these recommendations and before they kind of get finalized and go to the legislature. So we might not see things reaccelerate until then. Is that right? Or are we expecting like us to continue to full court press doing actual outreach between now and then? What are your all's thoughts on that?
I think this kind of is similar to what I just said to Jocelyn, in that there is nothing to stop CECC members from taking the resources and running with them.
Yeah.
And aside, the board will submit a report in September. The legislature will convene in late January or early February for the long legislative session. That will go until June. They will decide what to do with our report and recommendations and what of those recommendations, if any, to fund. And that funding will become available July 1, 2027. So if you're thinking full court press, like, public opinion polling, civic assembly implementation, regional listening sessions, anything along those lines that would take state resources, that is not even possible until the second half of next year, pending legislative investment.
That's, I don't know about everybody else, but to me, that's super helpful to hear you reiterate, because what it says is we're going to continue to draw on our own resourcefulness in the meantime to sort of build engagement. And that's not a bad thing. It's just, I was trying to get a feel for, again, for how that unfolded over time. And so some of these things are going to be one by one, like the great things that Mickey's been doing and the library idea and things like that we can continue to do and chip away at public awareness and engagement without that huge full court press like you described, if funding were to come online in July of 27. So
yes, yeah, you're right. And so this movement is there will be a funded government led public engagement process, and there always has been and will continue to be a grassroots movement building process, and they're parallel and they kind of build on each other's momentum. And so I think that your question is great, asking for this clarification. The government funded portion cannot, the earliest it can start is second half of 2027, but the grassroots movement building can happen anytime. So thank you for creating that clarity, John. I'm sure that other folks have that same question.
Well, I think it's exciting. I don't know everybody else, but that to me is kind of exciting because it says, until then it's a blank slate. I mean, we can leverage our collective know-how and networking, like Mickey has described, and kind of plan for that in a more of a grassroots way. And just having that reaffirmed means basically we've got 12 months of runway to continue to do our best at that before the cavalry comes in the form of funding, if it does.
And I don't know. Oh, sorry.
I was just gonna say, maybe it's too maybe everybody's too tired and hungry to get too excited, but
No,
I just drank a cup of
excited.
coffee, so fair, just to be honest. Yeah.
And I don't know, maybe Colin can speak at a future tech meeting about kind of HCAO's, their role as a nonprofit advocacy organization and what they will be doing once the legislature has the report in terms of next session, and that, because that will be like a separate thing that we aren't necessarily engaged in, but Colin can share that, if that makes sense.
Yeah, are you okay if I speak to that just briefly right now, or just yeah. Well, yeah, like John, the grassroots, there's a lot of grassroots things that are happening, right? And there's quite a few sort of players in the field that are not Healthcare for All Oregon, but we've been plugged in for a long time. And so if you want to get involved, we're things are happening, even if it's nonprofits, they're different. But we're getting a lot of things done. And then sort of in that same vein, this is a little bit of a segue because it's a comment towards Rob, but then also a question towards the group. So sorry to sort of like throw a couple things in. But Rob Archibald's comments in his public testimony, Rob, like, I'm glad that you were at our Hillsborough town hall, and of course it wasn't perfect. And I'm joking. I don't mean to sound offensive, but if we would love to have more support and more of your brain in the mix for the next series of events, or if you want to get involved at your local level, because there's a lot of us all around the state. And more about Rob, not to put him on the spot, but a question actually for the group, like him expressing interest in coming to the CECC. A lot of us, I believe, were chosen after we applied to be one of the 9 board members, right? And then that sort of shuffled out to be these different community engagement or these different committees. Does that process exist for new people to join the community engagement committee going forward? Like if somebody was to apply for those open board positions for Michelle and Amy, could they be considered for the committee? Is there a process?
I will just jump in briefly on that one, that expanding the committee is at the discretion of the committee leadership. So it is possible, and but it's kind of up to them.
And I will say it's the first time this has come up since we formed in fall of 2024. So the honest answer is there's not been a process. I'm sure that a process could be created. I think that we would have to check in with the board since Amy and I are stepping off. My term ends in September. I am curious, once we submit our report, what the capacity will be for ongoing committee meetings for this group. Most of the board's other committees have wrapped up. So there's a lot of unknowns. And I think that I would hate to onboard somebody if there wasn't leadership on the board or capacity on the board to continue co-chairing this group. So the board is kind of wrapping up our first 2 years, this first phase of work, and figuring out what the next phase looks like. So we will certainly be bringing these questions back to board leadership and staff to figure out what an equitable process is that allows people to participate, but also doesn't ask them to apply for something that's going to disappear in just a couple months.
Are there other thoughts and questions?
I did just want to super quick close the loop if you're going to share this idea of maybe activating OSU extension. I wanted to kind of underscore some themes that Michelle has talked about in months past. I think the community engagement piece would have huge appeal, and there'd be a lot of interest on the part of like the leadership of extension and stuff to sort of be a conduit for information sharing. But I think much like I think Michelle described the role of what you guys do in terms of the committee leadership is not necessarily being like a hardcore advocate, but just being, a little bit neutral and bringing information. So I think you all would know that. But the reason I wanted to bring this up again is to say I actually think I don't think we would necessarily need to wait for funding. I think we might be able to activate some of that extension networking asset sooner rather than later. Through the grassroots kind of phase. I think we could do that maybe and connect some of the dots with the only caveat is that it's not like it wouldn't be an advocacy function. It would just be strictly an engagement function. Hopefully that makes sense.
Thank you. I'm raising my hand to respond to John. Yeah, we obviously Healthcare for All Oregon, we do education and advocacy, but like a big but education is like a critical, I don't know, leg of the three-legged stool, to keep that metaphor going, of the things that we work on. So and I'm bringing it up because I think that just as far as like, even though it's a little roundabout, there is a degree of like nimbleness that that a nonprofit and other grassroots organizations can do. And specifically, John, in OSU, like Corvallis, the Mid-Valley Healthcare Advocates are like they're connected to HCAO. Actually, they were before us, and we share a lot of resources, but they exist. So I'm glad to talk more about that.
Yeah.
I raised my hands for 2 questions that are sort of separate. So I will ask them. The first is, Isabel, if you would prefer, I can just email you the documents, or if you'd prefer that I do the submission on the governance board page, just let me know your preference. And then my second question is regarding the 24 hours in advance. Like I know that that's a policy, meaning people wanting to speak to us or to governance board meetings must submit that 24 hours in advance. And I'm curious if that's like how set in stone that kind of policy is, and if we would want to recommend maybe to the governance board to shift that, you know, like potentially there's 20 people on this call. Maybe if there was no limitation, sounds a little more chaotic, perhaps, but there could be more. Okay, thanks, Isabel. Could be more engagement if there was no limitation like that. I understand the reasons why it exists, but I just wanted to bring it up. So.
I think that you know, one consideration is for agenda planning. So for example, next month we have Warren George coming to report out on a public opinion poll that was done in 2019. Am I saying that? Is that the right year? I don't have it in front of me. That he was part of making happen. And so when we try and identify what we will have time for on the agenda so that we can meet our public meeting law responsibility to be transparent about what will and will not be discussed at a given meeting. That is very difficult to do if we don't know if we're going to have 3 people speak at 5 minutes apiece or 20 people speak at 5 minutes apiece. Those are 2 very different things. And I think that if we said anyone who showed up could speak, and then we had more people show up than we had time, that would be really frustrating. So I really think it's most respectful to everyone involved to have some sort of a process. I know that too much structure can be constraining and not serve community needs, but lack of structure can also sometimes be really unequitable and have unintended consequences that harm people. And so I think we try to be Goldilocks with our level of structure. And yeah, that's what I would say in response to that. I don't know if Amy or Mimi have other thoughts.
I don't have additional thoughts. I somehow, I'm not sure what the, like, if there's regulations around that for state boards either. I'd have to ask Mimi about that.
Yeah, I can certainly look into it. I'm not sure. It's a board and committee chair decision, but I would echo Michelle's sentiments, certainly from a staff perspective.
Okay. Well, that, Michelle, you kind of got us to future topics, sharing about Warren George coming next month. Now's the time for us to do a reflection on today's meeting, what you thought, were the 2 presentations helpful, and what you would like to see in future meeting topics. I know it's getting late. People are getting tired and hungry.
Yeah, everything was, as usual, always helpful. Thank you so much. I have no additional topics to raise or request at this time. Thank you.
Thanks, Becky. Anyone? Colin?
I do. Yeah, I just wanted to highlight that there is the Healthcare for All Oregon annual conference this Saturday at Portland State University. I put a link in the chat with some more information, and there's an option to watch virtually, but we're excited to have some people attend in person, and I think a few members of the governance board are going to be there as well. So thanks.
All right. If I believe there's no other comments people want to make, I think our meeting is adjourned. Maybe we can give people a few minutes if they want to grab Colin's link for the conference this weekend.
I also just put a link to, so what I just referenced, that'll be a preview coming soon to a CECC meeting in June. We're going to have Warren George, so we're really lucky to have him present to us. He was involved in the Elway poll. He's also a task force member, and he was the vice chair of the Universal Health Plan Governance Board. So definitely wanted to make sure that I was referencing that poll correctly, so I put a link in the chat.
All right. I think our meeting is adjourned for tonight, so we will see you all in June.
Thanks, y'all.
Thanks.
Thank you, everyone.
Bye, everyone.